Community to Community's vision is development with dignity. No shame, no pity. We amplify dignity and progress led by the people of Petigov. In a world too often defined by headlines, something incredible is happening. Communities here don't just survive, they are working hard to thrive. Community to Community is working with the people of Petigov to restore vital resources. A much-needed canal is built one hand at a time. Roads are carved into a mountain with simple tools, bringing safe passage to their children and elders. This is development with dignity. And while access to continuous healthcare is saving lives, trees planted today will nourish future generations. Each person is building, planting, and teaching. We are not the heroes. You are. The person willing to support this movement and say, yes, I want to be a restorer of dignity. Join Community to Community.
Bonsoir, bonsoir tout le monde. Hey everybody, happy Haitian Heritage Month. If you're joining us in May, I know that you know, if you know a Haitian, you know the Haitian this month. Haitian Flag Day just happened and we were out there en masse because drapeau nous, son bagay ki très important pour nous. Our flag is a very, very, very important piece of our identity and our history. If you haven't read up on the Haitian flag, please do. It will teach you a thing or two about how, not just how we got our independence, but why, because that's the most important thing for you to know. And all over the world right now, we're blowing up spots. Culinary arts, we're getting awards. Sports, we're getting awards. In the entertainment industry, we're getting awards. Listen, and it's funny because for me, the food is the most important thing. As I love to say, I come from elite food culture. I only eat good food that tastes good, that has rich spices in it, that has a rich history. So if you have not had some Haitian food this month, make it your business to go and find a Haitian restaurant in your town, your city, and travel, because there's nothing wrong with that either. And find yourself some good diri ak sauce pois, some good legumes, some good banane peze ak pickles. Find it, then come back and thank me because I will have changed your life. Just telling you. So welcome back to Restoring Dignity with C2C, the podcast that I feel like is changing the narrative. I'm going to call it that now. I'm your host, MarieYolaine. I am the fire starter and the CEO of C2C Haiti, where our vision is development with dignity. When you support this mission, you're not standing on the outside looking in. You are a part of the story. You move from being a spectator to being a participant. Your giving makes lasting impact. So I encourage you now, go visit c2chaiti.org to learn more and to join us. I invite you to be a part of something much greater than yourself. Speaking of something much greater than ourselves, today's episode is called From Continuous Care to a Health and Wellness Center. This conversation is about what it looks like when care is not just a one-time response, but a long-term commitment. It's about what happens when a community is not forgotten after the headlines have faded. It's about what becomes possible when people build with a community, not just for the community. Today, I want to share how C2C Haiti's Continuous Care Initiative, also known as the CCI, has been serving families in our mountainside partner community in Petigov, Haiti, and how that work is now growing into a future health and wellness center, an actual brick and mortar where the Continuous Care Initiative will live and grow. And because the Gérard and Giselene Eusebe Golf Classic is this week, I also want to talk about why this event matters. So for those of you who don't know, and you would only not know if you lived under a rock, the 4th annual Gérard and Giselene Golf Classic is taking place Thursday, May 21st. Go to C2C All of the information is there. This year we're excited because we have partnered with the New York Birdies, and they are awesome individuals. I'm sure you've seen Conway, the VP of the Birdies, come on here. Their passion for the mission of development with dignity, 10 toes down. So you can come meet them. You can learn how to golf. You can join their golf club because they're always looking for members. You can come have lunch with us. Or if you will be on Mars, as I've said before, you are excused because you are on a whole other planet, and you can donate. C2C Go there, click, you'll see the flyer come up, click there, it will take you to the site that has all the information. So come on, join us. Again, wanting to say why this event matters so much and how you can still be a part of what we're building here. So let's get into it. When people think about healthcare access, when you think about healthcare access, you probably think about hospitals, clinics, or emergency response after a disaster. But for rural and remote communities, and especially the mountainside ones, access to healthcare is often much more complicated than that. In our mountainside partner community in Petigov, for example, families have had to live without consistent access to routine healthcare for decades. Decades. Imagine if it had been 10 years since you had a physical, 10 years since you had your eyes checked, 10 years since you saw a dentist, 10 years since you got checked for your prostate, 10 years since you went to the OBGYN. What state of mind would you be in besides terrified? Well, this is how some communities are living, not for lack of trying, because sometimes a mission or church will find its way up there, but it'll be another 5 years or never. So whatever help they did get, over time, it diminishes and it depreciates because it's not consistent. It's not continuous. Also have challenging access to clean potable water and basic preventative services. And when care is far away, expensive, or inconsistent, small health problems can quickly become life-threatening problems. That is one of the reasons the Continuous Care Initiative matters so much. The CCI was created to help bring care closer to the community, not just once, not just in a crisis, but continuously. That means creating systems that allow families to receive support in ways that are more affordable, more accessible, and more sustainable. The photo that you're looking at right now is Dr. Peter. He has been with us since we started the Continuous Care Initiative. And one of the things he loves to say is that he loves to be up on this mountain. Those are his people. And one thing we have noticed is that people are more inclined to be honest and to share more of what they're going through when their doctor looks like them and speaks their language. So Dr. Peter is also a great teacher. And so this picture is from the first Semaine Bonne Santé, the first Good Health Week that we did, where we brought multiple doctors, ophthalmologist, dentist, primary care physician. I feel like I'm missing one person, emergency room doctor as well, in order to really address what the community said that they wanted through a health survey that they did for us. And so as we triaged them, Dr. Peter, after they were signed in, before they went on to whatever doctor they were seeing that day, gave them basic healthcare and health information of what was going to happen throughout the day and what they could do to keep themselves healthy. It was awesome, right? So having more accessible and more sustainable healthcare, what does that include? Community health workers available daily. One of the things that we made sure to do is that the community healthcare workers and the teachers are all trained in CPR and first aid. It is very simple for a child to fall down, get a scrape on their knee or their elbow, where here we would just basically take some alcohol. Y'all been through that, right? Yeah. And all of a sudden you're like, the burn. But we know at least it's working. And then you put a Band-Aid on it and you go about your business. Well, that is prevention. But when you don't do that, and the wound doesn't get clean, so now you're susceptible to an infection. And that infection could lead to sepsis. It could lead to any kind of chronic situation, but the worst it can lead to is death, because that scraped knee turns into a whole other thing. Having the community health workers, which are people who live in the community, and the teachers trained in these basic health responses, makes everyone in the community just one or two people away from getting what we call premier soin, and that is the first aid, right? That you can get access to someone who can help you, who is on the mountain. Important. So that's daily. A nurse is available weekly. We have our nurses who come and visit. All of these folks are Haitian. All of these people were part of the community, which makes the health more personal and personable. So the nurse will be available. So let's say something happened and the scraping of the knee happened and first aid was applied. You'd only have to wait a couple of days before the nurse could come and address the wound, let the parent, teacher know that everything is fine, or that this child or this individual needs to go to the local hospital. And then the doctor is available monthly or as needed. We have medications for identified illnesses, lab services, health education, and a community-based system that helps people receive care without having to make a long 2-hour walk down the mountain one way, and then maybe spending 4 or 5 hours trying to get help or waiting at the local hospital or local clinic, and then having to make the trek back up for another 2-hour walk home. This is what continuous care looks like. Completely different from that. It's not just treatment. It is relationship. It is consistency. It is trust. It is prevention. And it is dignity. One of the most powerful things about the Continuous Care Initiative is that it has already shown what is possible. When we first started in 2017, when we launched it, we had it under the sky because we didn't have a location. We came back again and we had it under a tent. We secured tents. We had it again and there was a local school that let us use their facility. So we were like a traveling health oasis at that time. And that's when we said, you know what, we need to find a permanent home for this place, right? Because again, it's already shown what's possible. It has shown that when care is local, community-led, and consistent, lives can change. Families have been able to access services closer to home. Community members have a greater access to routine doctor visits, basic medications, preventative education, sexual health support, family planning support, first aid and CPR training, and health workshops on issues like hygiene, nutrition, waterborne diseases like cholera, diabetes, hypertension, and infectious disease prevention. This is how you make generational impact. Normalizing going to the dentist once a year, normalizing getting a physical every year, normalizing getting your eyes checked every 2 years, and having access to a pharmacy, to eyeglasses, to medication. This matters because health is not only about treatment. Health is about knowledge. It's about prevention. It's about helping people understand what is happening in their bodies and what risks they face, and what steps they can take to protect themselves and their families. And when a community receives care on a regular basis, I'm going to say that again. And when a community receives care on a regular basis, trust grows. That is something you cannot manufacture. It is so fragile and so strong at the same time. When you have trust, people are more likely to seek help early. They are more likely to take medications correctly. They are more likely to build relationships with local providers. And they are more likely to move from survival mode to a more preventative and empowered way of living. The first time we did the Semaine Bonne Santé, the Good Health Week, I remember me and the dentist at the end of the day. He came to me exhausted because he had been putting in like a 12-hour day. And he was in tears because he said he spent most of the day pulling teeth out. So now we're both crying because when people operate in their health out of emergency, it is always the last resort, not the first option. So when that person felt that little pain in their tooth, in their gums, I'm sure they did some home remedies, but they got to the point where they're like, I can't afford to go to the dentist. So as we say, bye, Vag, I just leave it alone, hope it all works out. But by the time they actually get to a dentist, it's too late. Now the teeth is rotted or there's an infection, so it has to come out. Just the dental health improvement we've seen has been worth this whole thing. So that is part of what we have seen through the CCI. We've also seen that when care is brought closer to the community, families save time and money. Instead of traveling 2 hours and paying much more for transportation, appointments, and medication, they are able to access lower cost care in ways that better fit their reality. And that matters because healthcare access should not only belong to the people who can afford travel, transportation, and any kind of delays. Healthcare access should not only belong to the people who can afford that. Healthcare access should be something communities can build into their everyday lives, not as a privilege, but as a right. So now we are building towards the next chapter. And that next chapter is the Health and Wellness Center. The Health and Wellness Center is not separate from CCI. The Health and Wellness Center, how can I explain? The Health and Wellness Center, the impact that it's about to make in this community is folks have been waiting for a very long time for this, since 2017. The Health and Wellness Center is not separate from the Continuous Care Initiative. It will work with the Continuous Care Initiative. It will be the home of the Continuous Care Initiative. So what people will have access to is healthcare, health education, mental health support, CPR and first aid training, women's health support, maternal care, and preventative services that help improve quality of life across the community. This center is about more than a building. It's about access. It's about dignity. It's about reducing the distance between people and the care that they need and that they have a right to. It's about helping families receive support without being pushed to the margins by geography, the cost, or neglect. And most importantly, it's about community partnership. We were invited into this work. We're in partnership. We are using a collaborative model. We are not imposing solutions. We are not coming with what we think should happen. We are not doing anything for the community. We are working with the community together. We are building alongside the community. This matters deeply because real dignity-centered work listens first. It honors local voice. It honors local leadership. And it believes that communities know what they need. One of the things I want people to understand is that C2C Haiti's work has always been rooted in partnership. This has never been about parachuting in with outside answers. This has always been about working with the community, listening to local leadership, and building systems that can be sustained over time. That is part of what makes this work meaningful. The local stakeholder association, APHD, has been at the table since the beginning. Community members have been part of identifying their needs. Local health professionals have played key roles, and the structure of this work has always been designed to build local capacity, local ownership, and long-term sustainability. That is the C2C way. It is collaborative, it is innovative, it is community-centered, and it is focused on helping communities move from dependency towards development and self-sufficiency. That is why the Health and Wellness Center matters, because this is not just about adding another service. It's about strengthening a model that has already shown impact and helping that model grow into a stronger future. And that's where you come in. That is why the Golf Classic matters too, because this year we partnered with the New York Birdies. The Gérard and Giselene Eusebe Golf Classic is not just a day on the course, is not just a fundraiser. It's part of how we help move this vision forward. It's part of how we build momentum around a future health and wellness center. It's part of how we invite people like you into this mission in a way that is tangible, joyful, purpose-filled. And because the Golf Classic is this week, there's still time for you to be a part of it. You can still register as a golfer, sign up for the golf clinic and learn. That's where I'll be. Come for the networking lunch. I'll be there too. Or make a donation. There are many ways to support. You choose how you want to make your impact. So whether you love golf, want to learn, want to connect with others at the luncheon, or simply want to give towards the mission, there is room for you in this work. And every act of support matters and is priceless to us. Every registration matters, every donation matters, every share matters, every conversation matters, because all of it helps move us closer to a future where families in Petigov have greater access to the care and support they deserve. I want to take a moment now to celebrate the strength and brilliance and excellence of Haitian people. You can tell, right? I am so happy God created me Haitian. I feel like you ever think about the package that you're in? Being created female, Black, and Haitian. In my life, as a kid, I thought those were liabilities. And that impacted my self-esteem, my self-worth, and my identity. As I grew, as I learned more about my history, shout out to my dad, right there, who made it a point to share his love for Haiti with me and to take me there on summers. I know that being born female, Black, and Haitian is the only package. Being in this package is the only way that I could do the work that I'm doing now. So I want to shout out to you that whatever package that you are in, know that the work you're called to do can only be done in the package that you're in. So whatever parts of you may think are a liability, they're actually an asset. Look at them again and imagine doing what you were called to do. Trust. You heard me say it before, and I'll say it again. God does not call the qualified. He qualifies the called. When he called me, I did not think I was qualified specifically because of those things. Turns out I'm qualified because I am female, Black, and Haitian. So think about this. Exactly how you're made is everything that you need to do what you are called to do. I'm proud to be Haitian. 24 hours a day, 7 days a week, twice on Sunday. Most Haitians feel that way too. That's why this week, many of us were proud to see Haitian football star Melchi Dumonet, recognized as best player in France's Akema Premier League. That kind of moment, shout out to her. That kind of moment matters. It reminds us that Haitian people continue to shine on the world stage. It reminds us that Haitian excellence is real and normalized. Because our parents, if you're Haitian, you know, l'église, l'école, la caille, church, school, home. Education, very important in a Haitian household. Trust, getting good grades. And if you're Haitian, you already know. That's why Haitian families are filled with engineers, doctors, nurses, lawyers. Who am I missing? Doctors, lawyers, engineers. Yeah, I think that's the main ones, right? Teachers. And of course, as we would say, footballer, right? So soccer, huge. Who doesn't want to be a soccer star? When I see this, for me, it reminds me that our people carry brilliance, talent, and possibility in every space that we enter. And it also reminds us why the work that we are doing here at C2C Haiti matters. Because when we invest in Haiti and in Haitian people, we are investing in strength that is already there. We are investing in dignity that already exists. We are investing in futures that deserve infrastructure, support, and opportunity. That is part of the bigger picture. This is why C2C wants to be a part of that infrastructure. And that is why we've been here for the last 16 years. With everything else that's been going on, I haven't had time to think about that. But it has been 16 years this month of May that I left my job at American Express to start Community to Community. And by the grace of God, because the calling comes with the anointing, praise the Lord, that I have been able to sustain myself, that I've been able to continue. Because some days, y'all, you're like, Lord, is there another? But in the words of Jesus, nevertheless, let it be as you've said. And then I keep going because I literally was facts complaining. But then I got up, dusted myself off, and went back in. So if you've ever felt that way in your calling, go through it, get to the other side, and keep going because the world needs you. So today, I want to leave you with this. The Continuous Care Initiative has already shown what is possible. It has shown what care can be local. It has shown that care can be local and what it looks like and the impact that it can make when care is local. It has shown that care can be consistent. 2017, 18, 19, 20, 21, 22, 23, 24, 25, 26. Every year, even through COVID in 2020, when we were not able to go down to Haiti, the Continuous Care Initiative continued. Why? Because from 2017 to 2020, the people were at the table. We'd already passed the baton. They put on the monthly doctor's visits on their own. And that is what collaboration should always be. Strength beyond the presence of one individual is what I heard. And we employ that. It has shown the community, it has shown that care can be community-led. And it has shown that when people are trusted, equipped, and supported, healthier futures can begin to take shape. Now we're building towards the next chapter. The Bonna Dieuseul, named after one of the community members who perished in the 2010 earthquake. The Bonna Dieuseul Health and Wellness Center will deepen this impact and expand what is possible for families in Petigov. And you can be a part of that. You can join us for the Golf Classic and support any way that you would like. It will still be golden and still be priceless to us. When you do that, you're not just supporting an event. You are supporting a future of healthcare, a future of dignity, a future of community-led wellness, a future where care continues. Thank you for being here with me today. I appreciate it. Thank you for caring about Haiti. That means a lot to me. And thank you for caring about dignity, because we're all worthy of that. In Haiti, we say, tout monde c'est monde. Every person is a person. So that means everyone should be treated like a person, because every person is a person. Thank you for caring about what it means to build with community. If you've heard something today that has stirred you up, please join us live. We'll be back again next week. Share this episode, if you're watching it, with someone that you feel also cares about the dignity of people. And help us spread the word about the Golf Classic. And help us build this Health and Wellness Center. I invite you, come be a part of something greater than yourself. Merci en pile. Thank you very much. I'll see you next time on Restoring Dignity. Eusebe.